Good morning. I'm going to follow in Nishan's footsteps and just give a 2-second précis as to how I came to be standing here today and why I'm interested in this area that I'm going to talk to you about. I was born at Great Ormond Street Hospital, not too far from here, 52 years ago, and I was born with spina bifida, and some clinicians in the room will know what that means, and then they'll also be wondering how I'm fortunate to be standing here today. I've gone through, or I went through at the time, 27 separate surgeries at Great Ormond Street Hospital and then subsequently at Guy's. But we mustn't forget, or I can't forget, that initially the doctors said to my parents, don't expect much from him. We've patched up the spine initially, probably going to be in a wheelchair, maybe calipers. But fortunately, that first surgery, Mr. Eckstein was the consultant at the time over at Great Ormond Street. Things started working, things started kind of responding better than they'd expect. They started trying surgeries that they'd never had to do before because no one had got to the point and had the success that I was blessed to have. 27 surgeries later, I was an N of 1, I've been quoted as. So I'm very, very conscious that I'm blessed to be stood here today. But the biggest sporting moment in my career was winning a sack race, aged 5. No social media, no videos, no evidence of my parents. My mother, a Maltese lady, literally collapsed to the floor when I won a sack race. It was a 40-metre sack race. I genuinely think the only reason I won is because I know that if you don't tuck your feet into the corners of the sack, you're not going to be biomechanically or even efficient in any way. I won basically because I was doping using my brain. But I'll still take that, and that photograph still sits on my mother's counter at home. Subsequent to that, I continued to develop and again be blessed by enhancements given to me by a wide, diverse range of clinicians at those 2 hospitals. But it got me using sport and education as a way of trying to prove that I was as good as everyone else in my classmates. The local education authority wanted me to go to a special school because I had an orthopaedic condition. Try telling that to a Maltese woman that her son needs to go to a special school, and you'll see the response you get. She, by the scruff of the neck, took the social worker into my preschool class and said, pick out my son. He couldn't. I was allowed to go to normal school. But what I did use was education and sport as the 2 ways I felt like I could challenge the guys in my class who were maybe more popular, maybe funnier, smarter. So for the rest of my life, I've basically been in education my whole life, like potentially some of my colleagues, and I think I'll stay here at the University of Hertfordshire for the next 10 years-ish, and then maybe get retired. What's important about that is through those 2 areas, I started noticing I was getting consistently different injuries that other colleagues at school weren't getting. I've got completely asymmetrical lower limbs from the knees down, one great calf muscle, looks like Michael Jordan gave it to me, and no calf muscle. A soleus on one side, no soleus on the other side. A high arched foot that's a different width to this foot, different lengths. But I started getting a lot of ankle injuries, a lot of ankle sprains and stress responses to sport. So through undergraduate degree, I started kind of looking at lower limb biomechanics as my area, and I've worked with some wonderful academics and research students over the years. But I'm going to talk to you today about some of the myths, some of the mistakes, and some of the measured management that's going on in the sector. And I'll also talk about some of the research we're doing, which is hopefully helping athletes like yourselves or clinicians to potentially get people back running after some of these sports injuries or back active again, without the risk of just being the weakest link and that athlete getting injured again as soon as they get back to sport. So I'm going to talk to you about where common assumptions fall short and what biology actually has to respond to. The marathon is one of the most studied events in the world. Yet depending on the data set, between 40... My click doesn't work. There you go. Was that me or you? We'll just keep going. Between 40 and 60% of runners will have sustained an injury during the training cycle. Let that sink in. Not during the race, during the build-up. The most common injuries are not exotic ones. They're predictable. Patellofemoral pain, Achilles tendinopathy, plantar fasciopathy, bone stress injuries. I won't be running tomorrow because I'm currently suffering from a bone stress on my left ankle. Marathon training doesn't cause injuries. The capacity-demand mismatch is what causes injuries. And as you can see on the side here, 60% of those athletes have had some kind of injury in the build-up to this wonderful race tomorrow. It's not your foot strike, it's the training errors. Many years ago, I would have stood here and talked to you about camber, incline, surface. Our thinking is changing in that area. We've spent decades debating biomechanics, rear foot versus forefoot strike, pronation, running form correction. But the data consistently shows that static biomechanics poorly predict injury risk. It's the training load errors that do. What we blame and have historically blamed is foot strike, type of shoe, gait abnormalities. What the data is showing us more and more now, and I'll talk about some of the work being done by the Run Safe group over in Denmark with Rasmus Nielsen, is its training calendar, training load, significant rises in mileage, repetitive high-intensity sessions. Just catching you up on some things I'll be talking about in today's session. So load, demand, and capacity. Load is external mechanical stress applied to the body in training and running. So that could be volume, miles and frequency. It could be intensity, pace, hills. It could be session type, the long runs or the speed work. It could be terrain, it could be shoes. Demand, however, is the resulting stress placed on the specific tissues by that applied load. This will vary with biomechanics, footwear, fatigue, and the types of tissue involved, bone, ligament, tendon, muscle. Whereas capacity is the tissue's ability to tolerate and adapt to that load over time. It reflects strength and tissue quality, recovery and adaptation, and biological state. And that biological state could be energy capacity and actual health. Load is what we apply to the athlete. Demand is where that load goes. And capacity is what the tissues can tolerate. So when I talk about those three concepts throughout the presentation, please keep those in mind. Marathon preparation creates a very specific pattern, a trap if you will. Weekly mileage climbs, long runs stretch further and further, intensity stacks, fatigue accumulates. And here's the mistake runners make. Runners increase volume before increasing capacity. Tissues don't fail because 26.2 miles exist. They fail because the 16-week build-up exceeds their speed of adaptation. And here's the predictable outcome. When load progression outpaces adaptation, by week 12, we're cross-training instead of running. Let that sink in. A significant number of people tomorrow, starting the London Marathon, will be starting hurt. Their performance will be significantly impacted by that because they've been cross-training for the last number of weeks. I'll talk about the capacity demand model throughout today's presentation. Keep in mind, every tissue has a load tolerance. When applied stress exceeds that adaptive capacity, symptoms appear. I explained this to my dad, an 82-year-old gentleman that I was going to present today, and he said, oh, okay, what you basically mean is the weakest link will fail first. Actually, yeah, I'll take that. Good insight, Dad. There's some really good work done here by Everett Verhagen and Tim Gabbett. What we see is spikes in load, spikes in intensity, a significant increase in the long run. What we're also seeing along the bottom, though, is reduction in strength, poor recovery, and low energy. And in some cases, cross-training that isn't doing what we need it to. The solution is not removing the stress permanently. It's increasing capacity intelligently. Everything else we discussed for the rest of my presentation will have this model in mind. As the capacity falls, it gets to the point where the demand exceeds the capacity. Injury occurs as a result of a mismatch, not specifically a fragility. Here's a case in example. This athlete, 42-year-old male, and over 3 weeks, his weekly mileage has increased by 15 miles. His long runs have increased 9, so from 11 to 20, and he's now suffering with Achilles pain. This is a very typical case, and these numbers are taken from club athlete numbers from across the UK, club athlete data from across the UK. This is not a shoe problem. This is not a form problem. It's a rapid increase in demand applied to tissues where the system wasn't ready. This outcome isn't bad luck, it's very predictable. Give you another example of a case we could have. Someone who hasn't done exercise since they left university at 21. They're now 41, and they keep applying every year to get into the London Marathon, and they never get in. But they're a stockbroker, no disrespect stockbrokers, and they've just decided to pay a charity £2,000 to get the slot. And they come to talk to us about being in the race. How should I prepare? The first thing I want to say is, how long have you been regressing your physical fitness? They were a hockey player in college, in university. It's been about 20 years. I don't want to facetiously say, well, you need to get into shape that you should be in as a normal human being at the age of 41. But don't go out and start hammering the pavements with a £450 carbon shoe. Biomechanics still matter. This is where biomechanics actually belongs in injury prevention. Mechanics rarely predict injuries on their own, but they absolutely determine where the load accumulates once the capacity has been exceeded. Biomechanics don't tell us if injury will occur. They explain how it occurs and where the load accumulates. Foot strike on its own doesn't cause injury, but it influences stress distribution where load is high. Shoes don't prevent injury. They alter joint work. Strength doesn't make tissue immune, but it raises the ceiling of what that tissue can tolerate. Mechanics shape stress once capacity is exceeded. And what we see on the right here is we have a visual representation of when load, capacity, and stress redistribution align, but in the wrong direction. And the Venn diagram shows in the middle, that's when you're going to have injury occurring. The carbon era. Let's talk about the carbon-plated shoe. The individual I gave in the example, his first park run, which is a Bishop Stortford park run, which is where I run my park runs. Our surfaces are tarmac, gravel, long grass, short grass, grass with molehills on it, and regular pavement. He rocked up in a £450 pair of shoes, chatting to me beforehand. I'm looking down at those and thinking, no, they're probably not the best footwear. Two examples here on the right. And this is in no way me discrediting the amazing technology and engineering going into putting these shoes together. It's just an example of that one athlete. But you can see the Vaporfly here and the Adios Pro from Adidas. These shoes clearly improve running economy. That's not up for debate. There's strong evidence in a number of different papers that's well established. The shoes will help. But mechanically, they alter joint work and they alter load distribution. This is as a result of an increased longitudinal stiffness. They're mechanical modifiers. They're not protective devices. They will modify your mechanics whether you like it or not. With my background, I can't help but run around a park run or a half marathon or a marathon without vocalising what I see. That's now why my daughter won't run a park run with me or a half marathon, because I'll say things like, "Can you hear the difference in that guy's left foot and right foot strike?" If you go through a tunnel or on a boardwalk, you can often hear a difference in foot strike. Or I'll say, "Look at his left shoulder, it's about 6 inches lower than his right shoulder." And she's like, "Dad, shut up." The good thing is now she's way faster than me, and now she just runs her own thing. But for many years, I found it very interesting to kind of do an observational gait analysis as I'm running around and watching people's individual challenges. We shouldn't assume, though, that having scoliosis, having kyphosis, having leg length discrepancy will automatically cause someone to have an injury. We have to keep in mind the combination between capacity and demand. Load redistribution. As I've said, carbon-plated shoes will reduce ankle joint work. They also reduce calf demand, and they increase forefoot loading. You see on the two images here, the one on the left is the standard traditional footwear with habitual loading, with a majority of the work, or a more significant amount of the work, coming through the calf. With the more stiff carbon footplate of the newer shoes, we're seeing that work come less at the calf and more significantly at the forefoot. We're beginning to see emerging clinical patterns, particularly forefoot stress reactions, when runners switch abruptly or rely on them exclusively. Super shoes don't remove stress, they redistribute it. And here's a practical shoe strategy. We consider the images on the right as a timeline, and we'd start where it says daily trainer. The takeaway is not to avoid these shoes. I love a pair of running shoes. I love a pair of trainers. I'm definitely not critiquing them to that extent. My advice here is to integrate them appropriately. Rotate footwear. Use race shoes early. Maintain calf loading whilst training, and also avoid exclusive use of the carbon-plated shoe. We were talking earlier, and the elites will race and use those shoes tomorrow, and they'll only use them once. They can afford it. As you can see in the image, we've got the base phase where you can use your traditional trainer. You then start dropping in the carbon-plated shoe in the early integration in the middle phase there and build, and then in peak, you're going to have a bit more of a strategic use of the carbon-plated shoe. Keep in mind, though, adaptation must precede protection. So, some injuries we label as overuse injuries are actually capacity failures. Bone stress injury is not always a purely mechanical problem, and tolerance can be biologically constrained even when training load appears appropriate. Reduced capacity changes the injury landscape. Keep that in mind. I'm not going to talk about relative energy deficiency in sport. I'm not a physiologist. I don't have that background. I'm not going to talk about that today as a diagnosis or nutritional consideration. I want to talk about how it strictly acts as a modifier of tissue capacity, and because that's where it intersects with load, biomechanics, and rehabilitation. When capacity is suppressed, tissues don't adapt to the load in the way we expect. Load appears appropriate, but the tissue fails to respond. Our role here is recognizing constrained load tolerance, not managing nutrition. Strength is not optional. Strength training is not optional in marathon preparation. Heavy, slow, resistance exercise improves tendon capacity. We know that. There's good evidence to show that. Hip and knee strength supports patellofemoral load tolerance. We know that. Strength doesn't eliminate stress. It increases the body's tolerance to it. And when load exceeds that tolerance, injury risk rises. Remember, load is not the enemy, inappropriate load is. Stretching is not harmful. It's just inefficient, insufficient on its own. Progressive load is underrated. Here's an example of some exercises within the literature that people suggest runners should be doing. Exercises such as single leg heel raises and controlled single leg squats increase calf and Achilles tolerance. This isn't about how strong the calf is for that single repetition. It's about whether it can tolerate repeated loading. And we can assess this in the labs. We're doing some really interesting work at the moment, looking at the way we can modify proprioceptive progression in exercise from a rehabilitation viewpoint. From a proprioceptive viewpoint, which is you're enabling your own balance, we know that people can single limb stance, balance on one leg, and the progressions normally are eyes open to eyes closed, or you make the surface less stable. We're now beginning to use audio cues and visual stimuli to try and imbalance the athlete so that we can have a better progression through the eyes open to eyes closed progression of proprioceptive rehabilitation. So some really interesting work we're doing there. Strength is capacity insurance. Where we can, we need strength in that lower limb. Return to run principles, very, very important. Pure pain-free feeling is not required. Using the example of the athlete in the earlier case with the Achilles issue, there's some really good pain monitoring models out there that tell us on a scale of 1 to 10, 0 to 2 is a safe zone, so discomfort but not pain. 2 to 5 is acceptable, but keep an eye on it, and then anything from a 5 to 10 pain scale is clearly a high risk. But we need to consider there's no increase in pain on the next day, no next day escalation, that we have gradual re-exposure to stress and load of running, and then strength symmetry where possible. Controlled reloading. Complete unloading reduces tissue capacity faster than most people realise. Rehabilitation is not rest, it's strategic reloading. You can see on the left here, capacity is dropping with unloading, but we want a graded re-exposure to increase capacity, or to restore capacity. Rehabilitation is not rest, it's strategic reloading, optimal loading to restore that capacity. So if we step back, 5 consistent truths emerge from my presentation that I'd like you to take away today. Loading errors drive injury. Capacity protects tissue. Context matters more than mechanics alone. Shoes redistribute stress, and strength is performance insurance. Marathon success isn't about surviving the 26.2 miles. In brackets, I know that's hugely stressful. I'm not undermining the concept. It's going to be very hot tomorrow, and you're going to have a very challenging race. The whole process of marathon success, from winning the ballot and getting the slot to crossing the finish line and being handed that bag, it's always really heavy because they have some kind of coconut water in it. I got arm cramp once because they gave me like 2 litres of coconut water, and I didn't recruit enough muscle fibres as they gave me the bag, and I was kind of like this, and she said, "Are your legs hurting?" I said, "No, I've got back cramp." The photograph of that is quite embarrassing. Keep in mind, I'll rephrase, marathon success isn't about surviving the 26.2 miles. That's the whole journey we're talking about. It's about respecting the biology of the build-up. Biology doesn't negotiate with ambition. That's not bad. I went a little bit over, but good time. Questions? Thank you very much.
Thanks very much, Andrew. Does anyone have any questions for Andrew? There's one over here, and then we'll... Okay.
Do you think there's a way to redistribute load from, let's say, soleus or gastrocnemius by doing more arm swings or slightly shifting biomechanics?
I didn't hear that very well. Sorry, I didn't hear that very well.
Training upper body, arm strength to
biomechanics? Yeah, absolutely. Yeah, upper limb strength is very, very important, and the functional movement of the upper body is absolutely essential. I was once followed through the London Marathon by a gentleman with his arms out carrying a cross dressed like Jesus. And we were talking about this last night. How he could run that fast, I think he ran sub 5, how he could run that fast without using his upper body to actually maintain standard gait is absolutely very, very impressive. Courtney, did that answer the question? So I didn't hear it very well.
It's about your on swing and to replicate if you don't have the soleus and gastroc strength, can it?
Yeah, quite often people's arms run as if they're running around a shop. Their arms move when they're running as if they're running around a shopping centre, doing some late Christmas shopping. In a perfect world, your arms will be moving in like flexion and extension of the shoulder in the direction of where you're running rather than across. Because if you start running across, it starts getting kind of trunk rotation things.
Great. I think there was... Yeah.
Thanks. Aging, how does that affect capacity? I'm thinking about sort of 60s and onwards for aging. I'm asking for a friend, you understand? And if it does have an effect, tips on managing that?
Yeah, so when we get to an age, I'm 52, so I'm not far off that age group, we do start losing muscle mass rapidly. Maintaining muscle mass, maintaining loading to your body wherever possible. I wouldn't say significant loading, don't start throwing weights around like clean and jerk, but loading will enable your muscle to have a greater longevity and maintain your resilience. It isn't for me about, I wouldn't suggest an athlete like yourself, it's about kind of hypertrophy or kind of looking in a certain way. It's the ability to maintain resilience and reduce fragility and not pull a hamstring when you lean down to plug a laptop in like I did a few weeks ago.